ECG, we have the TMT, we also have the training gym. Along with that, we also have the what else? The HRV, the HRV thing. Okay. So all of these, the students who are over here who are doing their PhD as well as the master's work are using these equipments to substantiate their work, whichever we are doing. In the center, we are very particular about the subjective and the objective measures. Each student has to have a subjective measure and along with that an objective measure is mandatory. Without the objective measure, we don't do even the master's work. That is why maybe the rate of publication from us is much higher. And the equipments which are used here are used interchangeably. It is not fixed that this equipment is for orthopedics alone or this is for neurology alone. The equipments are mixed up. And similarly, the students who are doing the sleep work are also using these equipments because we are trying to find out the correlations in between these and sleep. Along with that, as far as sleep research is concerned, after 4 days you must have realized that the amount of research available in sleep is much lesser. There is a lack of the normative data. So a lot of work which is being done in the center right now is also about developing some normative data as far as the correlations with sleep is concerned. So for example, autonomic nervous system is one thing which we are keenly working on right now. We have worked with autonomic nervous system in patients who are normals. We have worked on subjects which are normal, then we also have worked on subjects who have back pain along with that for normal. So a few of the students have also worked on trying to find out the correlation in between physical activity status and sleep and HRV. We have also worked on working women and how is their sleep associated with their HRV, where the physical activity status is poor. Some of them are intervention studies, some of them are observational studies. So both kind of work has been done. As far as the HRV is concerned, we have done both of the experimental studies where it's a one-time study. One-time studies are usually going to be giving you the data regarding your developing of the normative data, and two-time studies, usually post and pre studies when we do, they are more indicated towards finding out the effectivity or efficacy of the interventions that we are doing. The interventions as far as they are concerned, what we are doing in the center is concurrent exercises. We're talking about resistance training, we're talking about MFR, we have worked on what else? The body vibration we have worked on, and of course posture correction, because there is a study where the posture was studied, so a lot of posture correction studies, sensory motor training. So all these things we have either worked on or are in the process of working as far as the intervention is concerned. So these are some of the students who will be showing you the various equipment. So you can come in the front and have a look at the equipments here. From there we start. So this is the first one, that is an NCB equipment here. Maria would explain it to you because she's working on. Maria, you are explaining for the please explain. Maria, everybody can see it? Move the curtain on the side. नहीं ये बीच में ही रहेगा. बीच में. नहीं वो नहीं जाएगा. Okay, everybody can see it? Yes. Okay.
So here is the equipment we are having here. That is the RMS sleep-2. This is the Indian manufacturer modality that we are having here for our study. So by opening the software, can everybody see?
You can come in the front. You can come in the front. Yeah, it's okay. You can come in the front.
So in our NCS study, basically nerve conduction studies, we are mainly see the velocities, sensory nerve conduction velocities, and we compare it with their different latency, amplitude, and many more factors which are related to it. So once we are dealing with that, we have to see what nerve we really want to test, whether it's with sensory, motor, and mix, right? So when we are talking about upper extremity, where we have a number of nerves like including motor nerves, motor, radial and ulnar, and medial, motor, radial and ulnar, and in lower extremity where we are having like sensory, many involving like superficial cranial nerve, sural nerve, and in motor like we can take any of those like tibial and many more. So in this parameter where we have seen like there are given some predefined parameters, we can use it. We can't change it. It's predefined. Like it's suitably for all the patients. We are not going to change anything regardless where we want to see the things which we can control accordingly by giving all the information on the screen. So here I have taken some patient's data as you can see here. Data which I have taken from the patient. She is a diabetic patient, and I've taken it the motor value of median nerve, motor NCV value. So the threshold and the latency have been, I've seen it like it's decreased. So I can compare it with the normal distribution of the same from a normal person, right? So this is the study which I'm seeing. I'm seeing the differences in all the velocities, latencies, and I can compare it with the normal population too, whether it's related to the amplitude, latency, and many more. So these are the things which I have seen it, and I'm just comparing it. And by talking about the electrodes, we have only 3 electrodes we are using it: active, ground, and reference. We can keep it accordingly to the area which we want to test it, depending upon the sensory and motor.
Any questions regarding NCP? So this is the Delphi EMG machine that we have. Again, most of the students who are working on EMG are I think majority of the students from all 4 specialities are working on the EMG machine also. In EMG, one of the studies which we did on a center on neck pain patients, we showed an improvement in the EMG, and the EMG correlated with the sleep parameters in patients with chronic neck pain. The EMG parameters improved after giving an MFR. We also did a study in which the entire night recording we did for trapezius in patients with chronic neck pain, and we compared these recordings and these activities with the PSG parameters of the night. And we found a correlation in between them. In patients with chronic neck pain, it was found that the trapezius was much more active as compared to patients who were normal, and then after post-intervention, the readings of the EMG, the firing of the EMG went down during the night also. Okay? Ritika is going to explain you about this. Ashok, come this way.
So this is the Delphis machine. These are the electrodes. We use wireless electrodes for this machine. These are the electrodes. There are 6 electrodes which we have over here. And to pair the electrodes, first we have to charge them. Okay. After charging the electrodes, we open the Filmo software. The software used for this Delphis machine is the Filmo software. When there is red light, it means that the electrode is charging. This electrode is not charged yet, so we make it into red.
Do you have a pre-recorded thing there? How does it show that? This is a pre-recorded EMG reading. You can have a look at this.
Okay. So we can check the RMS value. RMS, MVIC, onset latencies, mean, standard deviation, ये सब हम चेक कर सकते हैं, जो कि हमने रिकॉर्डिंग की है उससे। जैसे मैं इलेक्ट्रोड प्लेस कर दिया, तो पेशेंट को ना थोड़ा विसिनिटी में जाना होता है क्योंकि वायरलेस सिस्टम है, ज़्यादा दूर जाएंगे तो फिर कनेक्शन फिर उसमें से खराब हो सकता है। तो बेसिकली ऐसा अगर हमने फिर जो हमने रीडिंग ली उसको सेलेक्ट करके हाँ, तो तो हम ना ये सारे वैल्यूज देख सकते हैं, मतलब नॉट जस्ट द RMS वैल्यू बट यू कैन ऑल्सो सी मीन, मीडियन, स्टैंडर्ड डिविएशन, स्टैंडर्ड एरर, RMS, मतलब सारे वैल्यूज हम इसमें देख सकते हैं। तो लेटेंसी भी अगर हमें निकालना है कि कौन से सबसे पहले एक्टिवेट हुई वो सब भी हम इससे कैलकुलेट कर सकते हैं।
इसमें हम एक चीज़ और है कि इसमें आप मल्टीपल इलेक्ट्रोड एक साथ लगा सकते हैं। जैसे अभी तो एक रीडिंग आ रही है कि यहाँ पे EMG फ्री कर दिया है, हमें फ्री वाला कनेक्ट है हमारा।
हम एक बार में 6 मसल्स की इसमें रिकॉर्डिंग ले सकते हैं क्योंकि हमारे पास 6 मसल्स।
तो यहाँ पे 6 वो आ जाएंगे हमारे आउटपुट और हम 6 रिकॉर्डिंग एक साथ ले सकते हैं। ये वाईफाई के थ्रू करना पड़ता है इसमें। प्लेसमेंट के लिए आपको क्या करना होता है इसमें
प्लेसमेंट की ना हमारे पास सीनियम गाइडलाइंस भी होती है, आप इंटरनेट से मिल जाएगा।
EMG का सीनियम गाइडलाइंस होती है कि आपको कितने उस पर प्रपोर्शन पे कितनी मसल की लेंथ पे हमें किस अकॉर्डिंग में लगाना है। हर एक मसल की अपनी अपनी एक पोजिशनिंग होती है। इलेक्ट्रोड
जैसे ट्रेपेजियस का होता है कि आपको एब्डोमेन और नेक के बीच में हाफ डिस्टेंस में आपको यहाँ पे लगाना होता है ट्रेपेजियस के लिए। फिर आप ट्रेपेजियस की एक्टिविटी कराओगे शोल्डर शोल्डर, तो उससे फिर हम RMS वैल्यू दे सकते हैं। फॉर MPIC उसी में आपको रेजिस्टेंस प्रोवाइड करना, पेशेंट को बोलना है टू स्ट्रक द शोल्डर, तो उसी में हमारी MPIC की
इसमें हम
वैल्यू
कोई भी प्रीवियस आर्टिकल वगैरह से रेफरेंस ले सकते हैं कि हमें कितनी टाइम तक कॉन्ट्रैक्शन कराना है। लाइक MPIC के लिए आपको 5 सेकंड्स का भी लेता है या फिर 3 सेकंड का लेता है। उस हिसाब से आपने अगर 5 सेकंड का लिया है तो उसमें से 3 हम एवरेज 3 रीडिंग्स लेके उसका एवरेज निकाल लेते हैं, जो कि हमें फाइनल उसमें हमारे काम हो जाएगी।
Any doubts?
आपको सबसे पहले याद रखना है इलेक्ट्रोड लेना है, जैसे हमें क्वाड्रिसेप का चेक करना है, ठीक है। तो RMS के लिए हम क्या कराना है, बेसिक क्वाड्रिसेप मसल का फंक्शन कराना है, जो कि क्या है, नी एक्सटेंशन। तो पेशेंट अगर सिटिंग पोजीशन में है तो उसको हमने बोला पेशेंट सिटिंग पोजीशन में है, नी एक्सटेंड करने बोल दिया उसको, ठीक है। तो RMS वैल्यू दे देगा, यहाँ पे ग्राफ बनना शुरू हो जाएगा, ठीक है। यहाँ पे टाइमिंग इंटरफेस आ रहा है कि हमें कितने कितने उसका लेना है, कितना हमें
सेकंड्स में वैल्यू आ रही है 1 2 3 4,
कितना हमें ग्राफ सेलेक्ट करना है, उस हिसाब से यहाँ RMS वैल्यू शो कर देगा। फिर नेक्स्ट क्या करना है, हमें MBIC कैलकुलेट करने के लिए पेशेंट को आइसोमेट्रिक कॉन्ट्रैक्शन करने बोलना है अगेंस्ट मैनुअल रेजिस्टेंस, ठीक है। फिर उसके बाद वो करेगा, उसकी भी हमें 3 बार कॉन्ट्रैक्शन करा के देख लेना, और जो हाईएस्ट वैल्यू आएगी हमें वो कंसिडर करनी होती है कि जो हाईएस्ट वैल्यू।
जैसे हमने ये टाइम सेलेक्ट हो गया 3 सेकंड से 6 सेकंड के बीच में, उसके बाद फिर हम गए इसमें, फिर हमने देखा RMS यहाँ पे लिखा हुआ है RMS, फिर हम RMS पे क्लिक करेंगे, फिर हमारी RMS की वैल्यू आ गई 0.129। तो अपने पेशेंट को
और जैसे ही हम इसमें ना यहाँ पे एक वो करके
मार्कर को जब स्टार्ट करेंगे ना, जैसे अभी तो स्टार्ट होने के लिए कनेक्टेड नहीं है, स्टार्ट करेंगे तो उसको हम कमेंट ऐड कर सकते हैं कि अभी हमने पेशेंट को कमांड दिया, तो उसके बाद फिर हम टाइम उसके अकॉर्डिंग ले सकते हैं। 6 सेकंड का ऐसे टाइम दे दिया,
उसके बाद हमने अभी तो RMS लिया, फिर उसके बाद हमने MBIC लिया। फिर MBIC के लिए भी सेम हम RMS वैल्यू लेते हैं, बट वो मैक्सिमम कॉन्ट्रैक्शन के साथ लेते हैं, आइसोमेट्रिक कॉन्ट्रैक्शन के साथ।
मतलब MBIC में आपको अलग से दिखता है कि MBIC है, मतलब उसमें तो हम रेजिस्टेंस दे रहे हैं ना, तो वो मैक्सिमम की कॉन्ट्रैक्ट कर रहा है, वैल्यू तो RMS ही लेंगे, वैल्यू है वही वैल्यू ले रहे हैं।
तो RMS और MBIC वैल्यू आ जाएगा, उस हिसाब से हम फिर मीन एस्टी निकाल के हम देख सकते हैं, कंपेयर कर सकते हैं कि क्या हमारे रेंज आ रही है अपनी कोर्स का।
Okay, please we move this side now.
क्या है ऑलरेडी
So this is the equipment which is So this is the equipment which is basically being used for measuring the autonomic nervous system. The device is there. She's going to be explaining you about the device, and we already have a preloaded available there for the one case that was recorded. So she's also showing you how the recording looks like.
The HRT heart rate variable shows about the cardiac autonomic function system, how the sympathetic and parasympathetic are working. The software here is the LabChart 7. Okay, this is the LabChart 7 software, and the power lag system is connected to it. So there is a 3 electrode that follows the lead to pattern of the ECG placement. The white electrode should be placed on the right valvulus here, and the black one should be placed on the left side on the left valvulus, and the green one should follow the right leg on the the right leg manually. Okay. So follow the lead-2 placement. They are the very prerequisite for proceeding the HRV. And the patient should not be consumed the caffeine 24 hours before the HRV demonstration. And exercise should not be done 2 hours before. And the patient should not have taken the heavy meal 3 hours before. And there are various prerequisites before proceeding the HRV, because it has having a various confounding variables that will affect the study. And the place should be very calm, मतलब शांत रहना चाहिए बिल्कुल, क्योंकि HRV की वजह उससे बहुत ज़्यादा हमें वेरिएबिलिटी देखने को मिलती है अगर ज़्यादा नॉइज होगा तो सबसे पहले हम HRV का आफ्टर लैब चार्ट ओपन करने के बाद देयर इज subject data. We should put here the name, age and the male. It should vary from the gender to gender, age to age. The HRV data is valid. Okay. So on the channel 3, we put the digital filter of 40 Hz cutoff frequency. After that, we put the electrode. We instruct the patient to be calm and अपने आँख बंद करके आराम से सो जाए. ज़्यादा कुछ सोचने के लिए भी मना करा जाता है क्योंकि इससे हमारे HRV पे इफेक्ट पड़ता है. And the basic definition of the HRV is the differences in the interbeat interval. The differences in the time interval of the various RR interval. Okay, and our heart is not a metronome that it should be repeated only after a limited second, only after 30 seconds it will beat. So the variability should be there, but variability should not be very much. Otherwise, it shows there is some pathological condition. Okay, so HRV is basically showing our sympathetic and parasympathetic system. There are two domains. There the time domain that shows our in the time indices. And there is the frequency domain. That is it is divided to various bands: low frequency, high frequency, ultra low frequency is there. So I will show you the report here. The time domain indices included the SDNN, standard deviation of NN interval, and then there is the RR interval. After removing the ectopic bits, we are having a normal to normal interval. So this is SDNN. In the time domain indices, we are having SDNN, RMSSD, PNN 50, and various total power should come in there. And in the frequency domain, we are having a LF, HF, and LF by HF ratio. So the sympathetic SDNN total power and the LF by HF ratio shows our overall HRV. That is showing the sympathetic and parasympathetic both. And the RMSSD value PNN 50 and the HF showing our the parasympathetic system. The value here is showing, and the LF showing, and the SDNN there is a conflict in between. It is showing overall or this is showing the asympathetic. Okay. So the LF and the SDNN shows our sympathetic system. The SDNN value should be greater than 100. Okay, for healthy population, 50 to 100 is for the compromised health, and less than 50 is for the unhealthy population. This is the data of a patient suffering from the hypertension. That's why the SDNN value is the 42, which is comes under the unhealthy population. Then there is the RMSSD value. It should be also the higher than the 50 millisecond. Then the total power it should be greater than 1000 for a healthy population. Then there is the LF and the HF value. LF showing our the sympathetic and the HF showing our parasympathetic system, and the ratio is showing our the dominance here. If the sympathetic is more, then our ratio will be greater than 1. Then there is a sympathetic dominance is there. So it basically understand our very well how our sympathetic and parasympathetic is worked. For our resting condition, parasympathetic should be dominant so that all the vital organs should work properly. And for any fight and flight condition, the sympathetic should be predominant. So this is the sympathetic.
You saw the PhD lab just now. Now this is the clinic where we are seeing all our OPD patients, and as well as that, the students who are doing the research are also collecting the patients from here if they are working on the patients. If they are working on normals, then of course across the university they have access to the neighboring area depending on the inclusion exclusion. But as far as the patient supply is concerned, this is the major area from where we are getting the patient supply. Along with that, the amount of OPD that we have varies between 65 to 75 to 80 also at times. The clinic is open to outsiders as well as to the Jamia faculty and the students. It is open for them also. And the clinic timing usually we start at 9:30 and we are going on till 5:30 with a break of around half an hour to 45 minutes in the day. We have 2 clinical therapists who are designated for the clinic completely. Along with that, the students are posted here, of course, and the faculty is also coming here on that. We have some equipments here which are imported, and we have some Indian equipments also. And usually we are giving the clinic is working on an appointment basis, and the variety of patient ranges right from ortho to neuro to pediatrics. We have almost all the kinds of cases included here. She is Dr. Bushra. She is in charge of the clinic here. She will give you a demonstration of the clinic.
So this is the electrotherapy unit of ours. This is from Zimmer. Basically we said it's Zimmer, right? And this is from German. And this is from Intravenous laser machine, right? And we have all the currents that you must all be knowing about this. And we have Intravenous laser here, right? And Intravenous laser is one of, we have one more there. But we have 2 ranges here, 5000 to 250 hertz, watts, basically, right? Any question you want to ask about it, you can ask. I can show you some other. This is the electrotherapy, not just we all know that we all are from the same fraternity, we all know that. So our main motive is that. And we have most of the data collection from here, as our students know that, right? So we have those kinds of patients inputs also. You all know about these machines. That machine must be new to you because it's being obsolete now. अभी हमारे पास सबसे पुराना मशीन यही है, right? And pi action basically, it has all the currents possible. Zimmer has all the combination possible, and we have vibration therapy there. Vibration therapy machine, right? And that area where you all had that session, we have a gym area. Basically, exercise therapy is done there. Pediatric students are those are admitted in our school or outpatient also. They come there. That's a pediatric session, exercise therapy session, and a gym area. Right? We do manual therapy here. This with manual therapy here or in whichever right? Microwave, and one more thing I was talking about as there. This. We have compression therapy also. This one. Microwave compression therapy, and we have obsolete shortwave diathermy, as everyone knows the reason. We have just microwave diathermy here. Any question you want to ask about any machine, you can. Both. Basically, that one has 3A also because of class for 3.